Welcome to Startup Health TV. This is another special COVID-19 health innovation update. This is Logan Plaster, Startup Health editor, and I am joined by Jonathan Dariyanani, CEO and co-founder at Cognotion. Jonathan, thanks for taking a few minutes to give me an update.
Sure. Our company does online workforce training, and our course is an allied health course. It's a CNA training course. It's distributed by, amongst other parties, the American Red Cross. And one of the things we realized as this epidemic became a pandemic is we had done the first responder training in Saudi Arabia in 2014 for the MERS coronavirus epidemic. So we had some idea of how allied health professionals. And about a week ago, General George Casey, who ran the US Army under President Obama, and I thought, what if we recruited, trained, and surged 1 million volunteers into the health system to support doctors and nurses and provided CRM tools? Could we turn those volunteers and the tools over to governors, hospitals, and counties to deploy people in the field? And so that's what we've been working on and standing up with cooperation of lots of large corporate partners. It's purely volunteer. Everyone is donating. We're donating the course. We've got people donating CRM systems and cloud services. And so it's really come together in a short period of time just to do what we can to help in the national emergency.
Okay, so let's break it down. So you are you're collaborating with all these different players in order to try to train in a rapid fashion what I said, like a massive workforce to sort of meet the challenge of this time. How do you train at scale like that?
Well, so our course was already built as an online course to do this function, right? It was built for all 50 states. It was built to do the function. It just wasn't built to address COVID-19 specifically.
Okay.
So we had the Yale School of Public Health, who's our partner, record some additional material to make it appropriate for COVID-19, which was challenging to do in this environment because it involved a certain small measure of risk on all the participants, but we felt it important to actually get it recorded.
When
So
you
we
say,
modified the
sorry,
course.
just to stop you there, what was the risk that you had to face?
Well, you're getting people together in person, right? And that's something that we try to minimize as people concerned with public health. But if you think it's necessary, you get 5 of us got together with appropriate, what you'll call physical distancing now, and we made that happen. So we've modified the course for the COVID-19 crisis. We have it on an Amazon supercluster, so it can take 24 million concurrent users. And then all the systems that we're plugging it into are all enterprise grade existing systems. So enterprise grade Fortune 500 CRM, enterprise grade onboarding and freelance management. Our course is enterprise grade. And then of course, the states and hospital systems and health departments that use it get to deploy those volunteers. They can pick, I need 100 people within 10 miles of this zip code who have a car and speak Spanish to staff a drive-through testing center. I need people to do telehealth call follow-ups with the following asymptomatic, positive COVID-19 patients, because the system no longer has the resources to call those folks and check on them. Check on homebound elderly, people with intellectual disabilities. Our prison population is going to have to be let go if there aren't volunteers to staff those positions. And states are calling right now for retired physicians and nurses, but we're quickly going to run out of those folks. And if we can't task shift and make them leverage their credentials so that they practice at the top of their license, we will run out of capacity very quickly. So this provides excess capacity to our frontline doctors and nurses so they can practice at the top of their license.
Now, obviously, top of mind for a lot of people are the recent labor numbers that came out, the recent unemployment numbers. And you're talking about being able to ramp up a workforce, a massive workforce in allied health. How do you see that playing into the economic side of this conversation?
Well, no, it's a very good question. And initially, it'll be volunteers because they're just hasn't been a paired up funding mechanism. The massive stimulus bill hasn't even been implemented yet. But what we're hoping is that states will be able to pour workforce dollars into this system to pay volunteers in a frictionless way. And our partners have agreed to waive all the fees. So if a state were to pour $1 million to give 1,000 volunteers $1,000 stipend, 100% of that would go to the volunteers. All the other costs are just borne in kind by the partners.
Got it. Got it. Now, just to fill out some details, you're training allied health professionals. What's the range? What does that cover exactly?
Well, so this course is just an emergency COVID-19 version of our nurse aid training course. So it's really taking vital signs, doing, you know, wound care evaluation, checking to see if a wound's infected, um, making sure that someone does their COPD exercises, checking on people with chronic conditions like diabetes, um, basic infection control, preparing a dead body. These are the sort of things that are covered in the course.
Got it. Got it. What kind of workforce shortage? I don't know if you have numbers that you use in your planning, but what are you kind of projecting and planning for in terms of what
Well,
you, yeah,
unfortunately or fortunately, no one really has ever experienced this that's alive at this scale. So it's impossible to plan. We get calls from both state emergency managers and large hospital system administrators. If the current trends continue, the demand will exceed 1 million people, but we think our system can reasonably accommodate 1 million people. And of course, there's a lot of parallel volunteer efforts going on that are all laudable and great. They just tend to be siloed and don't have integration of information. And so there's a lot of inefficiency because you can't match resources to need. So the reason we think that this system will be particularly effective is it has the training. So you can't bring people into the healthcare system who don't have basic training, at least on infection control and triage and vitals. So they've got a baseline level of training. They will have been automated, they will have been background checked and onboarded through an automated system. And you have CRM tools that allow you to manage them in the field. So it solves that last mile problem of I don't have the resources to individually call 100 volunteers or even manage the email traffic of scheduling them. Well, that can all be done by the system. And so that's really, I think, what makes it powerful.
Is this up and running? If I wanted to get certified myself in the event that in a few weeks my state had an emergency and needed to call up allied health professionals to staff, testing tents or whatever, where are we at in the rollout?
Now, you wouldn't be certified. You just do a volunteer emergency course
Okay.
that you would complete, and that would give you access to being called up as a volunteer. The
Okay.
states are not certifying anyone right now because the exams aren't being undertaken. But it's a very similar training that's been adopted for COVID-19. And then you can actually go right now today to volunteersurge.myabsorb.com and start training for free today. The CRM parts of the system and the task management are being brought up in the next 72 hours, and those will be available on volunteersurge.org, which is, which should be live next week.
Are both those sites? Say the first site again. Absorb.
So you could go directly into the course now on volunteersurge.myabsorb.com,
Got it.
and soon the main site will be live within 72 hours or so, which is volunteersurge.org.
Okay. So next week, late March, for whoever is watching this.
Sure.
Um, so I don't get certified, but I get that initial training just so that, potentially I'm ready to be a qualified volunteer in the healthcare system.
Yes.
Um, Interesting. And who are you working with? Who are sort of the big partners right now?
Well, right now, as you can imagine, big companies have PR departments that are in the process of vetting how they'd like to describe their relationship. But let's just say at least 3 of the top 25 tech companies buy market capitalization are partners.
Okay. Okay. And what do you feel like are next steps? Obviously, you want to come out with the site within the next 72 hours. What do you see as happening in
Yeah,
early
I mean,
April?
two critical points are surging volunteers into the system, which means getting the word out, which means companies emailing their employees, especially those that are furloughed, about letting them know about this opportunity on the one side. And then the second part would be connecting up with hospital systems and providers, states and county health departments, to make sure that they know how to utilize the service and that they are prepared for it. And so those are the two big tasks. So if people in the Startup Health Network know hospital system CEOs, county health departments, or insurance providers that are networked to the same, those would be very helpful folks to know, because if you're an ACO or you're a large hospital system, this will help you reduce load on your challenge system by triaging people and freeing up your doctors and nurses to deal with the most acute problems.
Is this something that the system needs now, or are you preparing for what we're going to need a week or 2 weeks or 3 weeks from now?
Yeah, it doesn't need it right now today. What we hear from the first responders in the field is 2 to 3 weeks from now is when the system will reach critical mass and breakdown. And that's when we need to be ready to supply additional staff.
With qualified volunteers who
Yes.
know what they're doing.
Yep.
Uh, I'm sure we're already seeing a bit of that in New York. You're probably following what's happening in New York City very
Yeah,
closely.
and so far they're getting retired doctors and nurses to come in. 30,000 people have volunteered, and that will help tremendously. But New York has two things going for it. One, it has an extraordinarily high concentration of healthcare professionals relative to its population. Well, three things. Two, it has a governor who's really been proactive about building these kinds of emergency response systems. And three, it has very dense networks of nonprofits and well connected people. There are a lot of parts in the country where they don't have all those things. They don't have the high ratio of healthcare providers to citizens, they don't have the density of connection, and they don't have the type of leadership that New York has in marshaling to this crisis. And so we want to help them get on top of this, even though, of course, we have had some conversations with New York, and we would love to be helpful to them as well. And they in California are really leading, the efforts here.
Is there a specific region or state that you're concerned about, given your vantage point?
Well, I mean, we're obviously concerned about the hotspot areas of Washington State, California, New York, but we believe that very soon this will be a problem, throughout the entire country. So, you know, we we we're hoping that we can be of service wherever needed.
Well, Jonathan, I think that's a good place to end. Appreciate the work that you're doing so much, and trying to prepare for what's next and increase that workforce capacity. How can people get in touch with you if they want to collaborate with you?
Sure. So they can email me at Jonathan, JONATHAN, at Cognotion, COGNOTION.com.
Awesome. All right. Well, keep up the good work.
Thank you, sir.
All right. Take care.